Hello, this is Chang here with Telos Functional and Integrative Medicine. Thank you for dropping by. In this brief video, I'm going to introduce to you the tests that we offer for a very specific and special subset of our client panel. These tests represent hormonal analyses. We see a fair amount of women who have concerns revolving around infertility, premenstrual symptoms, transitioning into perimenopause or menopause, and we also see men who have concerns about their challenges reflected in libido, testosterone issues, and so forth. We work with a great company out of Oregon that offers us a capacity to do very specific and precision testing. No pun intended. Precision Analytical Incorporated is one of our partners that offers a very unique way for us to assess hormonal functioning. The first of these examples I'm going to show you is called the Dutch Plus, or Dried Urine Test for Comprehensive Hormones Plus. And the plus refers to the salivary elements where we get to see a woman's cortisol response throughout the day. If you saw our earlier video or our video about the cortisol awakening response and diurnal cortisol pattern, this is what the plus from this particular test offers. So we get the power of assessing someone's saliva cortisol in comparison to the population that they are compared to. Equally, and perhaps more importantly for our practice, is that we get to assess a woman's estrogen, progesterone, and testosterone levels insofar as we're assessing their metabolites. Again, it's beyond the scope of this video to go into the utility and benefit of urinary metabolites versus serum testing. If you're interested, I just would direct you to the Precision Analytical website. They have fantastic educational materials for you there that are much better produced and are much more precise than what we could offer. For our purposes, this test gives us a sense of estrogen relationship to progesterone and testosterone, similar to the saliva cortisol test that we do. This provides us that map throughout the day, so we see what someone's daytime cortisol looks like. And importantly, it tells us how much cortisol is being produced, how much burden is on their DHEA reserve, as it were. This test is much deeper, and I think of in many ways of much greater value with regard to the particular interest we have in how these particular hormones are metabolized. Briefly, we can assess someone's androgens, or typically what is referred to as male dominant hormones, though men and women have a combination of the two, just the proportion is different. We get to see their progesterone metabolism as well. And in our particular clinic, we just are so grateful for this element where we can assess a woman's metabolism of her estrogen. We can see on this pie chart that in general, the preference is for the green pathway. And for those of you who are into the science, it's the enzyme that is expressed by the same gene metabolizes estrogen to a water-soluble substance that then can be removed from the body. So depending on how a woman's system removes estrogen and other like chemicals from the body, this is vital. These give us vast and precise information, and we can use very specific maneuvers, whether it be lifestyle, nutrition, to optimize the proportion here. We get to see, for those of you who are in the know, we can infer to some level of confidence whether someone may have a COMT or MTHFR mutation. Without necessarily having to do those tests, we can extrapolate with some confidence whether or not this is something we need to contend with, that is a COMT or MTHFR mutation, just based on whether or not this individual is methylating adequately or not. This is a fantastic test in and of itself. It gives us so much information. The precision analytical team includes some organic acid findings, which we will talk about on another video. What's of additional value to this provider is that I have the privilege of seeing a lot of young women of childbearing age who have any of a number of menstrual cycle irregularities or dysregulation, whether it be protracted menstrual cycles, irregular cycles, headaches in the premenstrual time frame, infertility. This test also offers us the capacity to map estrogen metabolites as well as progesterone metabolites throughout the month. So typically there are 9 collections that are collected every 2 to 3 days. We can actually map out and superimpose this on a reasonable population distribution, and we can actually see the path of travel, as it were, of estradiol and estrone. These are the 2 metabolites that we assess, and then the alpha-pregnenolone and beta-pregnenolone with regard to progesterone. So this is a very powerful tool for women who have any sort of concern with menstrual, hormonal related issues, and far beyond that. We don't necessarily want to leave the men out. There is a version of this that we can collect for the men, and the value of that is for, say, an individual, a gentleman who may have challenges with cortisol, testosterone challenges, libido compromise. You can see it's very similar. In fact, the cortisol testing is identical. The way this is displayed is identical, with the exception that there is not a progesterone level. We just assess estrogen and testosterone in men and use that information to build a treatment strategy that may or may not include replacement of these hormones, but in our experience, most importantly, to see where the potential sources of perturbations are coming from that might be compromising a gentleman's testosterone, for example. And you can see here, similarly, the way the metabolism is assessed here is equally important for both men and women. For those who are interested, we can direct you to another video of ours, but more, I think, impressively, you can go to the Precision Analytical website, and they'll give you a much more detailed and more comprehensive review. So, in brief, we offer specific hormone mapping and analyses for women and hormone analyses for men. If this is of interest to you, we invite you to contact us by going to our website and scheduling a free 15-minute telephone discovery call. 15-minute discovery telephone call, with our coach. We'd love to partner with you to see if we can't be of assistance to you as you try to optimize your health care and your wellness and your vitality and your reserve. This is Chang He with Telos Functional and Integrative Medicine. Thank you for joining me. We hope to see you soon. Bye-bye.